I'm going to show you some tools which are interesting to use when we are in AccuDoc. For example, I am in the current treatment and I have been doing a certain number of things, okay? But it happens that the implant have been placed before making the extraction. So this is a mistake. So what I'm going to do, I'm going to click on Display Order, and in Display Order, I am going to move the extraction before placing implants. So we've been doing crowns, we've been doing an extraction, then we place implant, and this is the good order. So I can close and save, and the order will be saved in a good way on that, keeping the dates and all. So this is on the part of the chart and the current treatment. But let's go now to another kind of treatment. We have a treatment plan, and the treatment plan has been done like this. Okay, we've been making an implant placement, then we've been making a crown. So again, we can find the display. The display is to put the crown after the implant. It's okay. If I want to move it, I can move it. You know the tool now. So what I can do also is I can update the name. So if I click here, I can change that for crown on implant on number 22. So doing that, you will see this title, which will be displayed in the treatment plan. I save changes, and with these changes, I better describe what will be used. Crown on implant on tooth number 22. So what I can do also is I can make a duplicate of the treatment. So duplicating a treatment allows me to go faster to set up a new treatment, including some of the treatment which were planned before. I can delete a treatment plan, or I can delete selected files inside the treatment plan. Using all these things, you can go very much faster to set up your cases in a good way. And if you select all this, you can also use a discount, 10%, that's it, and automatically it goes to 10% discount for your treatment. So what you have here is that you can propose that, or it can be accepted. And when it will be accepted, and with all the reference of the discount that you do and all what you do, you can change accepted to executed. And doing that, when I click on this, it will go automatically to the current chart with the current date. And this is where it comes now, implant placement and ceramo-metallic crown on implant. Okay, so these are the tools you can use. You have more tools to use in the treatment plan, and you can also edit some installment payment. Installment payment can be done for any kind of patient, starting from the treatment plan. Based on the full amount that the patient will need to pay, you can allow an installment payment. I thank you for your attention.